So uterine fibroid embolization, it's typically nowadays, most places, it's performed as an outpatient, should take an hour or less. We perform it through a 2 to 3 millimeter nick in the skin. We either can go into the artery by the groin, called the femoral artery, or we can go into the artery by the wrist and get there. And essentially we find the arteries that supply the uterus and fibroids, and we inject tiny little particles that are basically estimated to the size of the blood vessels supplying the fibroids. So over time, we know that size of particles, and what I tell my patients, it's a thing of physics. Those particles go in with blood flow. So fibroids tend to have bigger blood vessels and more blood flow than the rest of the uterus. So we kind of prune the tree to cut off the blood supply and hence the nutrients to the fibroids. So over time they shrink and die. So, it's not a magic eraser. I'm not cutting anything out. I'm not taking anything out. But in general, they shrink about 50% or more in volume. Women are able to go home the same day. The worst night, first night tends to be the most difficult from a recovery, just with menstrual cramping. By day 3, women are feeling pretty good, and usually by about day 7, people are back to their normal activities. So very simple outpatient procedure. You go home with a Band-Aid, essentially. Fertility. So same thing, over time, there hasn't been any head-to-head trials looking at fertility post uterine fibroid embolization versus myomectomy. So again, there's, looking at all of the studies out there, what I counsel in the most simplistic terms is, can you get pregnant after fibroid embolization? Are you guaranteed? No. Can you get, pregnant after myomectomy? Yes. Are you guaranteed? No. And it really depends on size, number, and location.